Thank you, Lesroy. I think to address that, I have to speak a little bit more comprehensively on mask and then end by explaining what was said there. There are a few things we need to understand, that the transmission of COVID-19 is by respiratory droplets. And when you cough or sneeze or talk, these droplets can travel at least 3 feet. And that's one of the reasons why we say that you should stay at least 6 feet from someone so that you don't get these droplets going into your nose, mouth, or eyes. Also, these droplets can contaminate surfaces. And if they contaminate surfaces and you touch these surfaces and you put your hand in your face or in your eyes, then you can become infected. And that's why we advocate for the personal hygiene, washing your hands, etc. Now, as it relates to wearing masks, the CDC recommends that persons wear a cloth face mask to cover their nose or mouth when they're in they are public in a community setting. In other words, if you are around persons. And the purpose of using that is not necessarily to protect yourself, but to protect others from the respiratory droplets that you might produce. Because you have to understand that this disease can be spread by persons who are pre-symptomatic, that is infected but don't know, and they're not having any symptoms, persons who are symptomatic, or even persons who are asymptomatic, which means that every single person who is in the public domain, they should be suspected of having COVID-19. And by we making sure that they cover their nose, cover their face, we would help to reduce the spread of these droplets. Now, these masks that we recommend that the general public use, it can be just a simple cloth face mask, as we said before, that is made from common household things. Now, somebody asked the other day who should not wear a mask, and I said before that these coverings should not necessarily be placed on children younger than 2 years old, or anyone who is having great difficulty breathing, or someone who is unconscious or incapacitated and is otherwise able to remove the mask themselves. Of course, if you have a parent with a child and they can comfortably take the mask off, then they can go out in public with a child who's 2 years old with a mask, because now persons are making masks for children even younger. As it relates to the surgical mask also, there's some myths that are going around, and there's only one way to wear a surgical mask. The surgical masks, they're generally color-coded. You have a color on the outside, and the inside is usually white. And so it is the colored portion that is worn outside. That is the only way to wear the surgical mask. Now, these masks, they tend to be 3-ply. They have an outer layer that is said to be hydrophobic, which helps to repel water or blood or body fluids. You have the middle layer that is the filter, and the inner layer that helps to absorb water or spit. So if you're talking, it will absorb the droplets that are coming out, the same way a cloth face mask is supposed to absorb the droplets. Now, why is it important for you to wear these masks properly? If you turn the mask the wrong way around, then you would be having the hydrophobic, or the part that is supposed to repel the droplets, against your face. And when you talk, these droplets will not be absorbed efficiently. They can also, if you wear glasses, cause your glasses to cloud up, etc. And what that would do, it will make people tend to touch their face, fix the mask, etc. And if you're touching a contaminated surface, then you can contaminate yourself. Now, what has been happening, a lot of persons have been using the N95 respirators in public, and these are not meant for the general public. The N95 masks, these are meant for healthcare providers who are in contact with persons who are known to or suspected to be infected with the COVID virus, because they have a very high filtration capacity. They filter out about 95% or more of the microorganisms, and they also have a very tight seal. Now, because of this tight seal, if you're wearing these for a prolonged period of time, it will cause carbon dioxide to build up. It will reduce your oxygen intake. It can increase your heart rate. And if you are sensitive to these things, then you can have deleterious side effects. And so no one expects in this COVID-19 pandemic for someone to be walking around, walking long distances with an N95 mask. I myself have been a surgeon for 20-something years, and I can go all day with a regular surgical mask on my face, but if I were to put on an N95 mask, I would have to take it off every 15, 20 minutes because you will get a bit short of breath because of the carbon dioxide buildup. And so the statement itself, although there's some truth in it, it is referring to the improper use then of the N95 mask. Now, there are also some other ill effects that can occur if you don't use the mask properly, and I'll just mention some of them. Number one, in wearing the mask, some people have a false sense of security, and because of that, they tend to ignore all the other social distancing things that we speak about and the hand hygiene. If you wear the mask inappropriately, then you tend to be always touching your face. If you have a single-use mask, there are some regular thin white masks that are just two-ply and they're meant just for single use, and you need to make sure that you change these regularly. Or if you have a cloth face mask, you need to make sure that you wash these masks. There are some persons, they go home, put the cloth face mask down as if it's like their shoes, and they take it up and put it back on the next time they come out. You need to make sure that you wash these, and if you're using a disposable mask, you need to make sure that it is disposed of properly. Now, in wearing the mask also, a lot of persons have found that it affects the quality of the speech, because your voice is muffled. And so some persons now unconsciously tend to come closer because they have on the mask. And so you break your social distancing protocols. Also, to some persons, pull the mask down to talk, and they're already closer to someone, so you can expose yourself to these respiratory droplets. The other thing is there are some persons in general who have difficulty wearing the mask, especially for a prolonged period of time, especially if these persons have underlying health conditions like chronic pulmonary disease, heart disease, etc. And they may not be able to even keep a cloth face mask on their face for a prolonged period of time. And so what I say in this era now, we have to use common sense and we need to be practical. And I assume too that the law enforcement will familiarize themselves with this also, because it doesn't necessarily mean that every time you're out in public, you should have your face covered. Every time you go out in public, you should have a mask with you. But if you are jogging on the bypass road, you don't need to have the mask on your face, because you can have a buildup of carbon dioxide, you would have decreased oxygen intake, and you will feel lightheaded, you will feel dizzy. You, however, need to have the mask available so that if someone comes within close contact or if you're passing a crowd, you can put the mask on. And I'm sure that the law enforcement will take these things into consideration. If you're driving your vehicle by yourself, you don't need to have the mask on your face. Sometimes, I've said before, I've seen persons driving by themselves and they have their mask on. Or there's some persons who would have slept the night with their wife and their children in the house close up, but then they jump in the vehicle and then they all have on a mask. If you're driving with the household persons you live with and there is no one who is in quarantine or isolation, you don't necessarily have to have the mask on. And so I don't think that the law enforcement should be stopping someone with a car just because they don't see the mask on. If they stop you and they ask you wear your mask, you show them that you have the mask available, because when you step outside and if you're going to be going into any area where you have persons, you should be able to put the mask on. There have persons who've been asking me, well, what happens when the beach is open? Do I have to swim in a mask? And we have to use common sense. If you're going into the seawater, we don't expect you to have the mask on. But if you're sitting under what do you call those things, little umbrellas with 5 or 6 persons talking, you need to have your mask on, okay? Also too, sometimes if you get short of breath, you can temporarily pull the mask down, because the same way I said for somebody who wear a mask for a prolonged period of time, if I have on a N95 mask, I have to take it down temporarily. There are a lot of persons who are not accustomed to have anything on their face, and some of them have underlying health conditions and they cannot keep a mask on for an hour, 2 hours, and so you should be able to pull the mask down and catch your breath and put it back on. And you also have to remember too that the same way you can have difficulty breathing, your child may have difficulty breathing, but the child might not know that the correction is to take the mask down temporarily. And so you always have to take into consideration the children that you have. So the statement that you read, there is some truth to it, but you have to take it into context. If you have a tight seal N95 mask that's not made for the general public and you keep it on for a prolonged period of time, yes, you can have CO2 buildup. Yes, you can have decreased oxygen intake, and it can adversely affect you, especially if you have underlying health conditions. Thank you.